You're welcome to another session with Dr. Mansky. Today, we are starting a series on mental health. Mental health is an important part of our lives. We realize that most of the time, we don't pay attention to our mental health and we don't pick up on certain things that happen to us. Today, for the first of this series, we'll be talking about bipolar disorder. Now, someone may ask, what is bipolar disorder? Now, literally from the name, bi means two, polar meaning poles. So basically means two poles. So talking about two opposite extremes. These extremes are the manic hypomanic phase and then the depressive phase. So talking about the depressive phase, that is when the person goes into severe depression. With all the signs of depression, the person doesn't want to be in contact with anyone, is not interested in life, and has or can have suicidal thoughts. When you go to the manic or hypomanic section, the person has heightened emotions and reduction of inhibitions. The person can do anything at all, can make drastic changes, expensive or buying spree, or even some very bad decisions without thinking through. This is the manic or hypomanic phase, and then in direct contrast is the depressive phase. Now, with bipolar, the person goes through these two phases, and that is what characterizes the bipolar disorder. What causes bipolar disorder? The exact cause is not known. However, it's been known that there are some biological and genetic factors that are at play in the cause of this condition. There are also some risk factors that are associated with it. These risk factors are having a first-degree relative. Now, a first-degree relative is either your parent or a sibling who has this bipolar disorder. This puts you at a higher risk of having bipolar. Secondly, if you have experienced a very traumatic event, such as losing a loved one or going through very traumatic events in your life, this can also trigger this bipolar disorder. And then finally, if you're taking alcohol or drugs, even though you may have it and it may be innate, these things can also trigger an episode and then you may be diagnosed. Someone may ask, how do I know I have bipolar? Now, if you experience all these extremes, in layman's terms, these extremes could be leaking of nude pictures of the person, tweeting or putting on social media some things that naturally the person wouldn't put on. And then all of a sudden, the person goes into a depressive phase where the person doesn't want to talk to anyone. The person is not interested in going to work, is not interested in doing anything, but would rather stay at home or be by themselves. Bipolar disorder is managed. Now, the first step of management is the support and love of family and friends. So if you have anyone who is going through this is not the time to draw back or the time to stigmatize. This is the time to show love and to show support. So that is the first line of treatment. Next comes psychotherapy and medications. Some people may just need psychotherapy, others may just need medications, and for people, they need both. Let's remember that anyone with mental health illness doesn't mean that the person is mad, but rather the person needs help. So don't shy away from such people. The reason I am doing this is that mental health has been misunderstood for the past years, and it's time for us to really understand what it is and give the support that we need and to help our family and friends who need it. So I hope you join us on this journey and help us with this series. If you have any question or any topic on mental health that you want us to discuss, or anyone you want us to even talk to about it, drop a comment in the comment section or contact us on any of our social media handles. Continue supporting this channel by liking and sharing this video. And for those of you who have not subscribed, hit the subscribe button now. My name is Dr. Mansky. Be safe and be healthy.